everybody, and welcome to this masterclass for achieving person-centered practice. So thrilled to be here. My name's Susie Murray. I'm the Nurse Manager Leadership Development for South East and Sydney Local Health District. And we've got my colleague and friend, Karen Tuqiri. She's the Director of Nursing at Prince of Wales Hospital. So Karen will say hello and introduce herself shortly. So we've got this space just to share really a journey. It's going to be telling you a bit of a story, a journey of co-creation, which was absolutely underpinned by the principles of practice development. So we'd acknowledge the Aboriginal and Torres Strait Islander people of Darawal, Gadigal, Wangal, Gweagal and Bidjigal people as the traditional custodians on the beautiful lands that we operate on. We pay respect to elders, ancestors, past and present. And South East and Sydney Local Health District is committed to honouring Aboriginal and Torres Strait Islander people's unique culture and spiritual relationships to the land, waters and seas and the rich contributions to society. Lovely.
Susie, you've put yourself on mute.
Sometimes harder on a laptop. So sorry, my name's Susie and my role in the strategy journey was as a co-facilitator. And with colleague Dan Shaw, who's currently at the Director of Nursing at Wollongong Hospital, and alongside Tanya McCance, which was an amazing experience. It was, to be honest, to me, a real career highlight to be part of this co-creation and to be able to work and co-facilitate at the side of Tanya, having, in our district worked for, almost 2 decades with practice development methodology and towards those person-centered cultures. So the co-creation of the strategy included our 8 facilities. And you can see on this journey here, we started off with Tanya, and overall she did about 11 workshops with the directors of nursing and midwifery. So the 8 facility DONMs, and then the district service DONMs for mental health, population and community health, and the district practice development and workforce managers. So you can see it's quite a journey that's represented here. The first beginnings of the workshop to develop the, strategy, Tanya really, she did most of them virtual, and then towards the end we got face-to-face with Tanya. So she began with sharing importantly, her 2 decades of person-centered practice research, that, the work that her and Professor Brendan McCormack have undertaken and led together. So that was sort of like the foundations and the beginnings. And then we went into values clarification with the DONMs. So this session was really an opportunity for them to understand the purpose, their shared purpose of person-centered practice and the underpinning collective values as nursing and midwifery leaders for the district. So this real enabler here was the collaborative, inclusive, participative principle and the need for skill facilitation. So this was facilitated face-to-face, this aspect. So you can see then the next step was priorities, and the directors of nursing were considered the priorities and they brought those together, shared, and eventually came up with 7. Town hall events, focus groups. This is evident of the inclusion of the nurses and midwives at every level across our district in the strategy co-creation. We got over 300 items of feedback provided in those sessions. Then when we were at a draft, we had more focus groups, as you can see there, which were around what's this telling you, how are you connecting with the strategy draft so far. So final feedbacks, non-clinical and nursing feedback, so a bit of an external review, which was very important. And that was looking at through the lens of others, and feedback around language. And then the design of the strategy, and then the launch, which was last year on November the 8th, which we would share with you. That was the 19th version of the strategy, so it had gone through many changes along the way. Okay. So, as we've said, the journey was facilitated and supported by Professor Tanya McCants. It was the district, are so grateful to her absolute dedication and expertise and the passion that she brought for person-centeredness. So we'll go now through this collaborative process with you. So the journey you've just seen, we'll unpack it a little bit more and share our outputs along the way. So engaging those relationships and building the ways of being was at the initial workshops initially was this is the foundations for the whole work together as the directors of nursing and midwifery. A real opportunity, as it says there, to build relationships, because working out in their own facilities, coming together in a space. And it was very much around what mattered to them, to be able to be in a space where that was open and they could have this honest dialect with one another. So that's their co-creation. That was one of the first outputs, and obviously that's what they work with till still today. The values clarification exercise, we were able to be face-to-face, but you can see those things on our faces there. It was actually in the COVID time. So we had the beginnings individually, the directors of nursing, what does person-centered practice mean to you, individual, and then we got them, they worked together and really shared and unpacked what that meant to. The first draft statement came out, and then we've got the values here. So the values were co-created, 7 underpinning values, and it was agreed through the critical dialogue the Donhams were having that they felt that the 2015 to 2020 Journey to Care values really remained relevant to them, and within their context, and continued to provide foundations for their behaviours that they would hope to see in action, their shared values. And then you could see right at the bottom there was a 7th one added: courage to be brave and lead through our use of voice and action. And yeah, there was an overwhelming consensus around that added value. So this slide is this is the final one, but at this stage we were at the draft purpose statement before focus group review. And so the purpose of person-centered practice is to enhance the human experience. This can be achieved by co-creating positive workplace cultures to provide safe, quality, and compassionate care. This will be underpinned by authentic behaviours that foster a shared understanding and innovative approaches to practice that will support positive outcomes. So this is the absolute foundations, and this shared understanding of what person-centered means to us across South Eastern Sydney LHD. Okay. So the next step was the consensus building around strategic priorities and the need to co-create the final priorities. So Tanya very cleverly facilitated this virtually, and we had the talents of Dan Shaw, his virtual facilitation skills. So each Donham brought well-considered and prepared 5 priorities from their facilities. So they were shared, and the Donham split off into small groups, shared their 5, really considered them. There was overlappings, there was some rewordings that happened, and then came back to the bigger group. And you can see on this slide, you can't read it because it's quite small, but there was actually 17 priorities across the whole group. And then from the 17, we did a nominal group technique response, and so each Donham had 10 to 1 to vote, so the highest to the lowest priority, and they further grouped and refined. The bottom right of the screen, you can see the top priority areas and how they were grouped, and the 17 became 7. Yeah, so the 7 priorities. So this is the strategy on a page. So the big visual is a 1-page that we've got around the district, which is A3. So you can see the 7 priorities, and Karen will share shortly how that collaborative inclusive process of actually co-creating the strategic actions under those. So within the document, which you can see the visual on the left, we've got this electronic document and also hard copies. There's each of the 7 priorities has got a focus area, and it's clearly defined, and also why that area is important. So it's unpacked, it's obviously a lot clearer and more thorough in the document. That's a picture of all the directors of nursing and midwifery from across the district at the top there. So before Karen shares those further with you, we want to just show you this slide. So we all know that, well, the 2021 Person-Centred Practice Framework, that's the image there, is built on the 2 decades of work by Tanya and Brendan. And they would actually share with you that this framework is a tool for our toolkit, because all the concepts towards enabling healthful cultures, those, healthful cultures are in there. And the person being our people, the teams that we work with, as well as the consumers of the services we provide. So it's a theoretical model that's been developed from practice for us to use in practice. So in our document, we had a wonderful page 7 to 10 in the actual document is actually written in the voices of Tanya and Brendan, and they share a really great overview of the person-centred practice framework. And we know that was important because we know our teams will read that further and within the document. So as we saw earlier, there's those 7 priorities. This slide represents how they actually align into the person-centred practice framework. And I think it's important that we make it clear that this alignment was considered, Karen, wasn't it, after we'd actually come up with the 7 priorities. So that the 7 priorities, they were put up on the screen, and then the directors of nursing and midwifery could see quite easily how they mapped to the person-centred practice framework. That real great alignment to the 7 key priorities. Okay, so I'm going to hand you over to Karen.
Thank you, Susie. And hello, everybody. As Susie introduced me very nicely before, I'm Karen Tuqiri, the Director of Nursing at Prince of Wales Hospital. And before I take you through the next phase of the journey for our strategy development, I would just like to preface this with that I think this experience for me as a Director of Nursing has been one of the most fulfilling activities and processes I've been a part of for many years. And equally, I feel very privileged to have been able to spend the time with my peers across the district in a space over 18 months where we've been able to pause and really critically think about the context in which we are providing care in for our communities, but also leading our teams through the particular different situations we find ourselves in over the last couple of years. And I think that's been a real privilege to be able to do that and have a strategic lens and really focus strategically around what the future needs to be invested in, but also the focus that we need to continue with. So that has actually been a real privilege there. And the third component of that has been the absolute delight in working alongside Professor Tanya McCants and really exploring person-centeredness and person-centered practice from a not only a theoretical point of view, but through what does it look like in practice? What does it look like, feel like, sound like? How do we know care that we're providing is person-centered? And then how do we actually transform culture for all? So it's actually been a wonderful journey that I'm really pleased to share with you today as well. So to pick up where Susie left off, once we had the priorities, I think it was really important that we went out to the workforce to all RNs, ENs, AINs, managers, CNCs, education staff, and really get their feedback. So we had a very significant stakeholder engagement plan to co-create these strategic actions once they had been drafted from a very high level. We had 14 sessions across the district. They were face-to-face, virtual, there was hybrid options. We had over 390 nursing and midwifery staff participate. And through that process and through the use of probing questions, we actually had over 2,000 responses received to that, which was a very overwhelming amount of data and information and feedback. But we were able then to use that through a thematic process of analysing it. As the dons, we sat in pairs and we pulled it apart and themed it down, and then integrated that into the versions that kept evolving. But it was really, really important at this stage to ask, the nurses and midwives for their feedback around where do they see themselves in this? Is the language right? Can they connect with it? We didn't want to develop a strategy that, whilst it might look great on the shelf and it was, very robust, we wanted it to actually be able to be used as a document to shape our programs of work in the future, and that everybody could resonate with. So it was a wonderful process. It went over a number of weeks, but a really important process to have those SIP principles around collaboration, inclusiveness and participation at the forefront of this work. The next thing I'm going to do is take you through the 7 priority action areas in a little bit more detail. So you can see, once we had identified the 7, what the actions and what we feel the next steps for us are as a district over the coming years will be. So if we just go through each of the 7, so the first one being the overarching developing person-centered cultures. Again, we believe that we are going to be focusing on, and have started to focus on, having a shared understanding of around what person-centered practice is, so that we are all speaking a common language. What does it sound like, feel like, look like? What are those different sort of perspectives across the many different clinical contexts in which we work? And how do we bring that together so we all know what we are talking about? I think that is a real fundamental in this program of work. Creating a workplace culture that aligns to those values that really support positive behaviours and healthful cultures. And what do we do to really enhance that in practice? How do we build relationships through engagement? And I think, we role modelled some of this through the stakeholder engagement, but how do we really use those SIP principles? Where do the nurses and midwives have the opportunity to use their voice and share their opinion, look for opportunities, share their innovations? And how do we really have a shared governance framework that would support that? And then how do we approach wellbeing? Knowing that there has been a significant focus on it for a number of years, but moving forward, what does that look like both at the individual, team and organisational levels? The next priority area is creating a supportive practice environment. A really key element of the person-centered practice environment is around that care environment. But this priority area just also it covers quite a broad understanding around the practice environment. So it's looking at workforce, it's looking at skill mix, it's looking at trends in workforce, looking at models of care, innovative approaches to that, looking at the impact of the physical environment of the care experience. And I think that is really critical for us across New South Wales in particular, but across our district. We have had a number of redevelopments in the last 5 to 8 years, which we really need to be able to evaluate the difference in physical environments on nursing and midwifery practice, and what we do around our workflows and how we provide care and in our models. So that is a key area. We also want to develop really key mechanisms that support critical reflection and shared learning with multidisciplinary teams, looking at clinical supervision models, and really having that vision around all of our staff having access to supervision and reflective practice should they want to participate. And then looking at voice, I think that was a really important discussion that we had in the early stages, and how do nurses and midwives share their voice and really impact and influence through the shared governance, as I mentioned earlier. So that is the second priority. The next priority we have in the document is building research capacity, which really speaks for itself. I think it's a key area for us over the next 3 to 5 years to really build capacity and capability for research of our nurses and midwives, and having models such as communities of practice that will support those conversations and that shared learning, establish pathways where our clinical staff can also dovetail into the academic sector through such things as associate adjunct pathways, which we've started, are really important, so that our staff have those opportunities to work across the sectors and be able to maximise the use of their skills and knowledge, but also their scope. Looking at funding opportunities and being really savvy around grants and funding that really will strengthen the research program across the district, and then looking at how do we actually use evidence to develop person-centred practice. And we have a strong goal of adding to the literature around person-centred practice, and hopefully, being able to supplement what's already there over the last few decades, and then also celebrating what we're doing in that space. And I think that is well underway at the moment. The next one is building a dynamic workforce, and this is really focusing in on our development and learning aspects, our education, looking at different models of education, looking at career pathways and how we succession plan, thinking about that from a different lens, looking at partnerships around with external education providers and how we may be able to cross into that postgraduate space in a little bit more robust ways, looking at the resources we need to build that learning environment and create those spaces where learning is most effective, and then also looking at how do we ensure that our nurses and midwives are working at their full scope of practice, and we have those opportunities for skill development that really is at that top end of the scope, but then what does advanced practice look like as well, and looking at roles such as transitional nurse practitioner, and so on. Fostering leadership at all levels, again, has been a long-term priority within this district through the different leadership programs that we've had access to. However, this strategic action will be focusing on the development of leaders who are not only compassionate but person-centred, and using programs that have that as the foundation, looking at clinical leadership and their role in developing person-centred cultures, investing in mentorship for leaders and ensuring that they have the support, and then looking at how do we celebrate and recognise the contribution of our emerging leaders in the future, and how do we support them in the best way. This priority area for me is a real focus, and one that I'm sort of spending a fair bit of time in at the moment, and that is enhancing digital informatics and new technologies. We recognised as a group of DONs that this is an area where we need to spend some time understanding. We've had a lot of introduction and implementation of digital changes, EMRs, different processes, but we really want to now go back and ensure that we have the right pathways for our nurses and midwives to develop the capability around using the systems, around digital literacy. The skills in data analysis become important. We also want to evaluate these changes in digital technology on nursing and midwifery practice, and really understand that from that humanistic side of our professions, and I guess having really good stakeholder engagement and collaboration is key to that, and really understanding the impact of these changes, which are often at a very macro level. What does that actually mean at the bedside or in the home where we are providing care? And then how do we integrate digital systems to support person-centred practice, and really starting to explore that will be also a feature of our work. And then finally, the 7th priority area, and these aren't in order of importance, these are just 7 in total, and we flex across them as we see the need. The last one is to discuss delivering high quality, safe, person-centered care. And I guess that is the cornerstone of the framework. It is ensuring that we have that person at the centre of what we do, whether that's staff, family, carers, uh, patients, consumers, the community members that work with us, the volunteers, the students, and really ensuring that we are adopting person-centered values and behaviours that support those relationships to be effective, creating the conditions to utilise evidence in a way that supports improvements in care, but also acknowledging what is the care experience for all, exploring innovative processes to communicating and evaluating experience, and then also looking at overall, how do we measure the culture and monitor sort of what we're doing and the impact it may be having, and how do we inspire that innovation, that creativity, and capture that. So that that in a nutshell is the 7 priority areas and some of the actions that we have committed to over the next couple of years. And I think what we do know is that through the stakeholder engagement, the language and the words that have been chosen now have had a number of nurses and midwives and non-nurses and midwives actually comment on. And so the language people can resonate with, which has been really pleasing to see that process come through. Another element of the strategy is we thought it was important to bring the strategy alive. And so each of the directors of nursing, once we had the strategic priority areas identified, were asked to identify programs of work we already had within our services that would align to these priority areas, knowing that we weren't starting from a blank canvas and that we did have great programs of work already in the district that would be very clearly aligned. And you can see on the screen, there's a number there. Each of the DONs provided multiple exemplars, and these have now been included in the strategy. So if you are reading the strategy, you're reading a priority area, you're seeing the actions that we've committed to, then you're sort of identifying and being able to read through some best practice exemplars of what is already happening, just to give you that sense of what does this look like in practice. And that has been, again, a really important feature of this work. Once we had multiple versions and evolved it to a point, we did want to go out and do another round of stakeholder engagement once we had the exemplars as well identified. And so we ran focus groups with 3 key questions that you can see on the screen. I think the key question for me is the third one. In reading the strategy, can you see yourself as a nurse and or midwife within it? And that, to me, if a nurse or midwife cannot see themselves in this work, then we're not going. We didn't have traction. And so those responses and answers were really reassuring. And I guess if someone didn't see themselves in it, they gave us some tips on how that could be turned around, and we used those. And I think that was really important to do that. The feedback from the leadership groups across the district is where we focused with these focus groups as well. And I think we know that our leaders at all levels will be the ones that will actually be leading the strategy on the ground, and it's important for them to be able to see themselves in it as well. So once, this is an example, once we had the groups, this is one of the murals that we used virtually with them, and you can see there the answers to the questions and how we then themed that to bring it down and ensure that anything we needed to incorporate was put into the final version 19 as we moved towards the end of that process. So that was that in a nutshell is the process that we've covered. And then we had a launch last November, and you can see there that Tanya was in Sydney, which was fabulous, Brendan came as well and had an opportunity to put a frame around the work that we had done. And then Tanya spoke about the processes that we had used and the person-centered practice framework and how we had together as a group of directors of nursing and senior leaders worked alongside of her in that space to where we are today. And we had a panel where the audience could ask questions. It was a wonderful event. It was with our chief executive and our tier 2 executives, as well as all of our nursing and midwifery leaders from across the district. Following that, the next day, we had a Directors of Nursing and Midwifery workshop that was facilitated by Tanya and Val Wilson and the district team, Susie and Dan. And this was a really important spot for us because whilst we had developed it, printed it, launched it, this was about implementation on this day. And what did this mean to each of us from across the district, and how were we going to implement this in our facilities and services? So we did really an interactive approach to the day. It was a creative space. It was to consider what did implementation look like, what was sustainability, what would evaluation look like, and what would a governance model be that would support the approach that we had agreed on. We had lots of blue sky thinking opportunities. We had creative opportunities. We really had an opportunity to do a claims, concerns and issues. And through the co-creation of the issues and the critical questions, this has really informed our action plan for the next steps in what we've done since November last year. I think it was important. A question was, what would successful implementation of the strategy look like and how would we know? And we are creating an evidence we created an evidence wall around what that might be. But since then, that has continued to evolve, and our evaluation strategy is still needing to be further developed and confirmed. But in overall, the group felt that our clinical outcome data, our patient experience, our staff progression, and workforce KPI data were just a few things that we need to start with in the first instance. So that's a work in progress at the moment. So implementation and evaluation, these are some of the key building blocks of that. We had the district launch, and then each of the directors of nursing were tasked with a facility launch, which we've all had, and we've started the implementation with our local teams with the support of the district team. We also know that our district nursing and midwifery team have had their own workshops and implementation planning. We have started the development of an evaluation framework, but as I said, that needs further work. We have started to develop and establish a very different SESLHD shared governance model, which really rethinks our committee structure and really starts to think about a community of practice model for some elements, where it's opened up to a broader audience who have a like mind and a common passion or purpose. So that is also being developed and implemented as well this year. And then I've put at the bottom here, and it's quite large, but I think it is a foundation. And we have been very fortunate that our District Director of Nursing and Midwifery has supported action learning sets for us that happen every six or so weeks with Val Wilson, who facilitates, and we were able to come into that reflective space and explore implementation, explore person-centeredness, explore our own leadership in that space, and really just bring anything we like to that. It could be a challenge, it could be something really specific, but it's a wonderful space to be able to sit in, and I think that's really been important for my professional development and that support network that we can provide each other. And so to finish, I would just like to leave you with a few words from Tanya and Brendan, which feature in our strategy. And I think as you listen, I would encourage you to consider what really resonates with you and what is your future vision of person-centeredness. So person-centeredness is a global movement in healthcare simply because it reflects the importance of keeping people at the centre of healthcare systems. It prioritises the human experience and places compassion, dignity and humanistic caring principles at the centre of planning and decision-making, and is translated through relationships that are built on effective interpersonal processes. We advocate the importance of the underpinning values of person-centeredness, where the core value of respect for the person is paramount. So these words is what we keep in the front of mind, and I would encourage you to think about that. I hope you have enjoyed our journey today, and we would really welcome any feedback. There is an evaluation available, and we thank you for your time today.
Thank you. Thank you all. Yes, as Karen said, you can use the QR because that feedback will stay open. Thank you very much.